Welcome back to Skills Live. I'm Shannon Penrod. I am here with Dr. Doreen Granpeesheh. It is such a thrill to have you here.
Thank you. It's a pleasure.
You're so busy, and so we don't like to impose upon your time, but this is a real treat to have you here, and I know that there are many people who are watching who are excited to have you here as well.
Thank you.
And one of the first things, usually when I get somebody in here, one of the first things that I ask them is, did you plan on building a life around autism, or did this happen to you like it happened to us?
Right.
How did you get here?
I guess it did happen to me as well, but I guess it was an interesting process for me. When I finished high school, I had applied only to UCLA.
Oh, funny.
And thank God I got in. And one of the very, very first courses I took at UCLA was the behavior modification course, which was taught by Ivar Lovaas. And so I liked that course. I mean, not that I thought it was the best, but it was a fantastic course. He's great. He was a great lecturer. And then I was trying to get into clinical psychology, which means sort of the practice of psychology, as fast as I could. And his clinic was the first place that you could actually get contact with patients. So I continued the series of courses that he had, which were practicum courses, and then got into his clinic as an undergrad and started working there, and then moved up the clinic. And then by the time that I graduated, again, I had actually, for grad school, I did apply to a bunch of other places and got into some nicer places, but rejected them because well, actually, because my father said, hey, it's better if you stay in LA. So I was like, okay, I'll stay in LA. So stayed at UCLA grad program, and then became heavily involved in the Autism Project, which we changed the name to at UCLA and turned it into the Clinic for the Behavioral Treatment of Children. And so at that point, as a grad student, really there was just two of us. It was me and Tristram Smith. And Tris was more of a researcher, and he right now is one of the most published and incredible scientists in ABA, and he is at the University of Rochester. And I was more of a clinician, so that's how the clinic there was divided. I was in charge of the cases and developing the curriculum and seeing the patients, and Tris was doing most of the research. So then again, 1990, I finished there and did a bunch of different postdocs. Didn't like anything else. At this point, I didn't really know much else because I had spent my entire life just doing autism, undergrad and grad. But it is unbelievably rewarding, right? Because not only do you make a very significant change in the children that you work with, but also very, very important for me was the change that we were making with the families and the parents. And just kind of I think what kept me was the feeling that, I would have a parent come to my office late at night at UCLA and just fall apart. And this is a long time ago. There were much less back then in terms of services and knowledge and so on. And I would just sit with the family and the parents and walk them through and try to take away some of their fears, And at that point I realized, I think the thing that's actually most important to me is that process. I mean, thank God that I've been very, very lucky and blessed to have so many incredible clinicians join me along the way and just develop CARD in such an amazing, magnificent way. That I could, for me, it was more really about how can I help the families? What can I do for the moms, the dads? It is just, and I feel like, there's no way I would ever really know because I haven't had my own child go through this, but I've experienced it with people a lot of times. So that was really the main thing for me. I did really fall into it because my path crossed with Lovaas's, but very, very quickly I realized that this is an amazing area to just be in. And, in Shannon, in the 70s when I was at UCLA, nobody knew anything about autism, really. It just was not recognized. And that kind of made it even more intriguing, because it was like, all right, well, maybe I can figure out what this actually is, because I can see with my kids. In those days, the DSM, I think we were on DSM, the Diagnostic Manual 3 or 2 or something, a long time ago. And, you know, one of the things that was correlated strongly on the diagnostic was mental retardation with autism. And I'd had my kids, the kids that I worked with, and I had much more time with them, and I would see there's no way this kid is mentally retarded, no way. Like, yes, that's how he scores on a test, but that's because he doesn't understand language. Like, how, you know, it's like giving an IQ test to someone in Chinese. Like, there's no way he's going to do well because he's not understanding. But then he'd tell me, you know, exact details of roads and things on buildings that had changed 6 months ago. I mean, his memory was unbelievable, his attention to detail and all those types of things. So that just didn't make sense. And it was very clear early, very, very early on, that the kids just have incredible strengths in different areas of their brain, and perhaps not the strengths that help them survive. Those are the areas we need to work on.
And that intrigued you and excited you.
Absolutely. Absolutely.
And I see that in you. It's funny, you know, hearing you talking, and everything makes so much more sense. And I was talking about you earlier and my experience with you, and how I came to know you, and how I just thought in the beginning that you were just awesome at putting together people. And I associate this place as the place that miracles happen.
Oh, that's so nice.
That, you know, you created a place in which I got my child back. I could, you know, how can I ever repay you for that? And so I thought, oh, she's awesome at putting these people together. And then I heard you speak, and I heard you talking to parents, and I saw that you got it in a way that so many people don't. That you really, really got it. And now I've watched you work with children, and you see the whole child. You really do, and you don't judge. And so many people see our kids and they just see the diagnosis and they don't see beyond that, but you don't. And you have a way about you with the children that's amazing.
Well, thank you. I honestly, before I had my own kids, you know, so I was working with kids with autism since '78, right? And a lot, like very involved in their lives. And then I started having my own children in '95. So I did not even know typically developing kids. And I had already established a whole massive relationship with thousands of kids with autism. So when I learn every day, Shannon, honestly, I learn every day from my kids and from some of the senior clinicians here who have different perspectives as well, and from the world. Like, you know, back in those days, there wasn't so much of a, we've been through so many phases of learning, it's unbelievable. There was no understanding of, let's say, theory of mind or perspective taking, and that the children have that deficit or problem. There was really very little understanding about executive functions and how it actually applies to autism and how we do that. Everything was either, you know, it was very, very rote behavioral. So you only look at the behavior of the child and you try to change it. And it's funny because in that realm, I feel CARD has learned so much. We've grown so much. Whereas the world of behavior analysis is really just beginning to go down that path. Our staff, when they present at various behavior analytic conferences, and they talk about things like using ABA techniques to teach a child cognitive skills like how to lie, or a white lie, how to have a conversation, how to understand social settings or people's gestures and those facial reactions, all that sort of stuff. The other behavior analysts are pretty shocked. They're like, oh wow, that's why you're going inside? Like, you know, nobody, you're not supposed to go inside. You're supposed to treat the individual like a black box and, you know, do outside manipulation. So it's really interesting. We've learned a lot in that area. We've learned a tremendous amount in the medical area, obviously. There was nothing back then. And that was one of the ones that kind of intrigued me very early on.